We take our cars in for maintenance at the first sign of a problem. So why don't we treat our bodies the same way? The truth is, our bodies send warning signs when something is wrong, but many people ignore them until it's too late. Some symptoms might seem harmless at first, but they could indicate serious health conditions like heart disease, cancer, diabetes, or even life-threatening emergencies. So today, I'm talking about 10 medical symptoms you should never ignore, and when you need to see a doctor immediately. Let's start with a big one, chest pain. Now, not every chest pain means you're having a heart attack, but it's crucial to know the difference. Chest pain can feel sharp, dull, tight, or heavy. If you experience chest pain that's sudden and intense, especially if it radiates to your arm, jaw, neck, or back, call 911 immediately. This is especially important if the pain is accompanied by other symptoms like shortness of breath, nausea, dizziness, or sweating. Sometimes, a blood clot in the lungs called a pulmonary embolism can cause similar symptoms. Don't try to tough it out or wait to see if it goes away. If you're ever in doubt, call for help. Have you ever felt incredibly full after eating just a small amount of food? It happens to all of us occasionally, but if it's a frequent occurrence, it could be a sign of something more serious. This feeling of fullness, even after eating very little, is called early satiety. One possible cause is gastroparesis, a condition where the stomach takes too long to empty its contents. Other digestive issues like acid reflux or ulcers can also lead to this feeling. In some cases, particularly in women, persistent early satiety, especially when accompanied by bloating and pain, can be a sign of ovarian cancer. If this is a recurring problem for you, it's crucial to consult with your doctor. Alright guys, let's talk about something that should always raise a red flag: blood in your stool, urine, or vomit. While a minor issue like hemorrhoids can sometimes cause blood in the stool, it's crucial to never ignore this symptom. Blood in your stool could indicate a problem in your digestive tract, such as colon cancer, inflammatory bowel disease, or diverticulitis. Blood in the urine, known as hematuria, can be a sign of a urinary tract infection, kidney stones, or in more serious cases even bladder or kidney cancer. Seeing blood in your vomit is also a major warning sign. It could indicate a tear in your esophagus, gastritis, or even stomach cancer. Any bleeding after menopause is not normal and should be checked out by your doctor right away. If you notice blood, don't hesitate to contact your doctor immediately. We've all experienced stomach aches, they're a normal part of life. But how do you know when abdominal pain is something more serious? Persistent or severe abdominal pain that lasts for several days or comes and goes frequently should never be ignored. Severe abdominal pain can be a sign of something serious going on inside, such as appendicitis, which requires immediate medical attention. Other possibilities include gallstones, which can cause intense cramping pain, or pancreatitis, and inflammation of the pancreas. If the pain is accompanied by other symptoms like fever, vomiting, or bloating, it's essential to see a doctor as soon as possible. Don't try to tough it out or self-diagnose. Have you ever experienced sudden flashes of light flickering spots or what looks like a curtain or shadow moving across your field of vision? While these can sometimes be associated with migraines, they can also signal a serious eye condition called retinal detachment. The retina is the light-sensitive tissue at the back of your eye that sends signals to your brain, allowing you to see. When the retina detaches, it's a medical emergency that requires immediate attention. If left untreated, retinal detachment can lead to permanent vision loss. If you suddenly notice flashes of light, especially if they're accompanied by a shadow or curtain-like effect in your vision, don't wait to see if it goes away. Early detection and treatment are crucial for saving your sight. Pain during or after sex is something we often avoid talking about, but it's more common than you might think, and it's not something you should ever feel embarrassed or ashamed to discuss with your doctor. Painful intercourse, also known as dyspareunia, can affect both men and women, and it can be a sign of an underlying medical condition. For women, painful intercourse can be caused by conditions like endometriosis, pelvic inflammatory disease, or fibroids. It can also be due to vaginal dryness, which is often related to hormonal changes, or vaginismus, a condition where the vaginal muscles involuntarily contract. Men aren't immune to this either. Pain during sex for men can be caused by infections, prostatitis, or Peyronie's disease, a condition that causes curvature of the penis. If you're experiencing this, please talk to your doctor. They can determine the underlying cause and discuss treatment options to help you find relief and enjoy a healthy sex life. We all feel tired from time to time, especially in our fast-paced world. But if you're constantly feeling exhausted, even after a good night's sleep, it's time to listen to your body. This type of fatigue goes beyond just feeling tired. It's a persistent lack of energy that interferes with your daily life. It could be something as simple as an iron deficiency, also known as anemia, or a vitamin D deficiency. But it can also signal more serious underlying conditions, such as hypothyroidism, an underactive thyroid gland, or even heart disease. Other possibilities include chronic fatigue syndrome, a complex disorder characterized by persistent and debilitating fatigue, or sleep disorders like sleep apnea, where you repeatedly stop and start breathing during the night. If your fatigue is persistent and doesn't improve with lifestyle changes like getting enough sleep, eating a healthy diet, and exercising regularly, it's crucial to consult with your doctor. They can help determine the underlying cause and recommend the appropriate treatment to get your energy levels back on track. Headaches are incredibly common, and most of the time they're nothing to worry about. But there are times when a headache can signal something more serious, requiring immediate medical attention. Tension headaches, the most common type, typically feel like a tight band around your head. Migraines, on the other hand, are usually more severe, throbbing headaches that can be accompanied by nausea, vomiting, and sensitivity to light and sound. If you experience the worst headache of your life, it could be a sign of a ruptured aneurysm, a weakened blood vessel in the brain that bursts open. Other warning signs include a sudden headache that comes on like a thunderclap, especially if it's accompanied by confusion, slurred speech, weakness, or numbness in the face, arm, or leg. These could be signs of a stroke. Headaches that worsen progressively over time, especially if they're accompanied by neurological symptoms like vision changes, seizures, or personality changes, could indicate a brain tumor. Fever is your body's natural defense mechanism against infection. When you get a fever, it means your immune system is working hard to fight off invaders like bacteria or viruses. But while a low-grade fever is usually nothing to worry about, a high fever that persists for an extended period can be a sign of a more serious underlying condition. If your fever is very high, over 103 degrees Fahrenheit or 39.5 degrees Celsius, or lasts for more than 3 days, it's essential to see a doctor. This is especially important if the fever is accompanied by other concerning symptoms like a stiff neck, severe headache, confusion, difficulty breathing, or a rash. Shortness of breath, or dyspnea, is a scary symptom that should never be ignored. It's the feeling of not being able to get enough air, and it can range from mild to severe. If you suddenly feel like you can't breathe, or your breathing is shallow, labored, or painful, seek immediate medical attention. One serious possibility is a pulmonary embolism, a blood clot in the lungs. Other serious causes include heart failure, where the heart can't pump blood effectively, severe asthma, pneumonia, or anaphylaxis, a severe allergic reaction. If you have asthma or another respiratory condition and your shortness of breath is getting worse despite using your usual medications, don't hesitate to seek help. So, there you have it, 10 medical symptoms you should never ignore. Your body has amazing ways of telling you when something is wrong, but are you listening? Ignoring these warning signs could have serious consequences for your health. Remember, early detection is key. The earlier you catch and address these symptoms, the better your chances of a positive outcome. If this video helped you understand these important warning signs, give it a thumbs up, leave a comment below, and subscribe to my channel for more videos on how to stay healthy and live your best life.